As summer travel approaches, millions of people across Europe and around the world are eagerly making plans to explore new cities, reconnect with loved ones, and enjoy the vibrant culture and history that the continent has to offer. Airports and train stations are filling up, and families are packing their bags for long-awaited vacations. But this year, a major health alert is overshadowing some of Europe's favorite destinations, casting a shadow over the excitement of travel season. Health authorities are urging travelers to be extra cautious as they prepare for their trips. Health officials are warning of a serious hepatitis A outbreak in Austria, Hungary, Slovakia, and the Czech Republic, countries many travelers flock to each year for their rich history, beautiful landscapes, and unique experiences. The outbreak has prompted swift action from local governments and international health organizations. Thousands have already been affected, with fatalities reported, making this more than a minor concern. Hospitals are working around the clock to treat those who have fallen ill, and the impact is being felt not just by locals, but by visitors as well. The European Centre for Disease Prevention and Control has issued a clear warning: cases are rising fast, and travelers need to pay close attention to the latest updates. The situation is evolving, and staying informed is more important than ever. This isn't about canceling your plans or giving up on your dream vacation, but about being informed and prepared. Simple steps can make a big difference in keeping you and your loved ones safe while you travel. Infectious diseases don't respect borders, and this outbreak is a powerful reminder that even familiar destinations can pose unexpected risks. Whether you're traveling for business, leisure, or to visit family, it's crucial to stay vigilant and take precautions. Over the next few minutes, we'll break down what hepatitis A is, how it spreads, where it's currently spreading, who's most at risk, and most importantly, what you can do to protect yourself and your travel companions. We'll also share practical tips for staying healthy on the road. Let's get you ready for a safe and healthy holiday so you can make the most of your European adventure with confidence and peace of mind. Hepatitis A is a highly contagious virus that specifically targets the liver, an organ essential for filtering toxins and supporting digestion. When the liver is attacked by this virus, it can become inflamed and unable to function properly, leading to a range of health problems. Hepatitis A is often called the dirty hands disease because it spreads so easily through poor hygiene practices. The virus can survive on hands and surfaces for hours, making it easy to pass from person to person in everyday situations. The virus is found in the stool and blood of infected people and is mainly transmitted via the fecal-oral route, often through contaminated hands, surfaces, or food. Even a tiny amount of the virus, invisible to the naked eye, can be enough to cause infection if it enters the mouth. If someone with the virus doesn't wash their hands properly after using the restroom, they can easily spread it to others, especially when preparing or serving food. This is why outbreaks often start in places where food is handled by many people. Outbreaks are frequently linked to restaurants or food handlers, highlighting the importance of both public and personal hygiene. Regular hand washing with soap and water, especially before eating or preparing food, is one of the most effective ways to prevent the spread of hepatitis A. Contaminated water and raw foods like salads or shellfish are also common sources of infection. In some regions, drinking water or ice made from contaminated sources can carry the virus, as can eating raw or undercooked seafood harvested from polluted waters. While many cases of hepatitis A are mild and people recover fully within a few weeks, the disease can sometimes cause severe illness, especially in older adults or those with pre-existing liver conditions. In rare cases, it can even lead to acute liver failure, requiring urgent medical care. This is why health authorities are treating the current outbreak with urgency, launching public awareness campaigns and encouraging vaccination in high-risk areas. Quick action can help contain the spread and protect vulnerable populations. It's not just a stomach bug, it's a serious liver disease that can have lasting consequences. Recognizing the symptoms early, such as jaundice, fatigue, and abdominal pain, is crucial for seeking timely treatment. Understanding how hepatitis A spreads is the first step to stopping it. By practicing good hygiene, staying informed, and supporting public health efforts, we can all play a part in preventing future outbreaks and keeping our communities safe. As of June 2025, over 2,000 hepatitis A cases have been reported in Austria, Hungary, Slovakia, and the Czech Republic, with 9 deaths. Slovakia leads with 880 cases, while the Czech Republic has 600 cases and the highest number of fatalities. In Hungary, adults are most affected, while in the Czech Republic, children are a key group. Austria's numbers are lower but rising rapidly, already surpassing last year's total. These figures are a wake-up call for anyone traveling to these regions. The outbreak is active and growing, making vigilance and preventive action essential. Don't let your holiday become another statistic. Take the warning seriously. Anyone unvaccinated or never exposed to hepatitis A is at risk, especially travelers from countries where the virus is rare. Children are particularly vulnerable due to inconsistent hygiene and mild or hidden symptoms, making them silent spreaders. Tourists face higher risk by eating out, using public restrooms, and being in crowded places. People with chronic liver disease or weakened immune systems are at greatest risk for severe complications. Older adults and those with health conditions should be especially cautious. The bottom line, if you're not vaccinated, you're vulnerable. Prevention is critical for everyone, but especially for these high-risk groups. Hepatitis. Symptoms often mimic the flu: fever, fatigue, muscle aches, and headache, making early detection tricky. After 2 to 4 weeks, more specific signs appear: nausea, vomiting, loss of appetite, and pain in the upper right abdomen. Watch for pale stools, dark urine, and itchy skin, signals that the liver is struggling. The most telling sign is jaundice, yellowing of the skin and eyes. Not everyone gets jaundice, but if you do, seek medical help immediately. Even mild symptoms after travel to affected areas should prompt a doctor's visit. Early diagnosis helps manage symptoms and prevents further spread. Don't ignore persistent flu-like symptoms. Get checked. The best defense against hepatitis A is surprisingly simple. Wash your hands thoroughly and often. This means scrubbing with soap and water for at least 20 seconds, making sure to clean under your nails and between your fingers. Hand washing is especially important after using the toilet, changing diapers, or touching anything that might be contaminated. Always wash your hands before eating or preparing food, whether you're at home, in a restaurant, or traveling abroad. Clean hands are your first line of defense against germs that cause hepatitis A and many other illnesses. When you're traveling, especially to places where sanitation may be a concern, be extra cautious with what you eat and drink. Follow the rule: boil it, cook it, peel it, or skip it. Only eat food that's been thoroughly cooked and served hot, and choose fruits you can peel yourself. Avoid raw salads, uncooked shellfish, and unpeeled fruits or vegetables, especially in areas where outbreaks have been reported. These foods can easily harbor the virus if they've been washed or prepared with contaminated water. Drink only sealed bottled water, and say no to ice in your drinks, since ice is often made from tap water that may not be safe. Even brushing your teeth with bottled or boiled water is a smart precaution. If bottled water isn't available, boil water for at least 1 full minute to kill any viruses or bacteria. Let it cool before drinking, and store it in a clean, covered container. These habits may seem basic, but they're powerful barriers against infection. Practicing good hygiene and being mindful of what you eat and drink can make a huge difference. But there's one more step you shouldn't skip: vaccination. The hepatitis. A vaccine is safe, effective, and provides long-term protection. It's usually given as 2 shots, 6 months apart. Once you've had both doses, you're protected for years, often for life. If you're heading to a country where hepatitis A is common, getting vaccinated before you travel is your best safeguard. Check your vaccination records and talk to your doctor or a travel clinic well in advance. By following these simple steps, practicing good hygiene, being careful with food and water, and getting vaccinated, you can protect yourself and travel with confidence, knowing you've taken the right precautions. European health agencies urge travelers to Austria, Hungary, Slovakia, and the Czech Republic to check their vaccination status and practice strict hygiene. The ECDC and national health bodies recommend vaccination for anyone visiting outbreak areas. The UK's NHS now advises hepatitis A vaccination for travelers to these European hotspots, a significant shift in policy. Consult your doctor or a travel clinic before departure. This advice applies to all travelers, not just backpackers. If you're infected, avoid preparing food, sharing personal items, and drinking alcohol until cleared by a doctor. These measures are vital to stop the spread within families and communities. Follow official guidance to protect yourself and others. The UK is also seeing a spike in hepatitis A cases, with 95 recent infections and over half requiring hospitalization. The outbreak is linked to a contaminated food item, showing that even countries with high sanitation standards aren't immune. This highlights the importance of food safety and hand washing everywhere, not just abroad. Most UK residents lack immunity, making them especially vulnerable when traveling to outbreak regions. The advice: wash, produce thoroughly, practice good hygiene, and get vaccinated before traveling. The risk at home may be low, but it's never zero. Stay vigilant whether you're traveling or not. The hepatitis A outbreak in Central Europe is serious, but you can protect yourself with a few simple steps. Practice meticulous hand hygiene, be careful with food and water, and get vaccinated before you travel. Health risks aren't limited to far-off places. They can appear anywhere. Talk to your family about hand washing, pack sanitizer, and consult your doctor about the vaccine. These actions aren't burdens. They're your best tools for a safe trip. Enjoy your travels, but stay informed and prepared.